we start to follow the natural cycle. When we see the 17 millimeter of the follicle, we give to the patients one injection, and 36 hours after this injection, we are expecting the ovulation of the patient. And this time is considered like day 0, and 5 days after, we are planning the embryo transfer. This is for the natural cycle. If we do preparing endometrium with suppressing ovulation and with the hormonal tablets, in this case, we start on the second day of the menstruation to give the tablets, and the patients use at least 13 days those tablets, and 13 days after, we are calling back the patient to check the ultrasound with ultrasound her uterus, and if needed, with the biochemical test to check if she is ovulated or not. And then this day is considered like day 0, and 5 days after, we are planning the embryo transfer. Okay, it means when in this artificial cycle, it's like 18, 19 days until the transfer from the beginning. The indications for the frozen embryo transfer is two things. Until a couple years before, for all patients, we are always considering the fresh embryo transfer normally. But according to some studies, many centers, many IVF centers started to quit the fresh transfer and to do all patients, to consider all patients like frozen transfer candidate. Because when you compare fresh to the frozen considered what's like more successful. But 2 or 3 years after, they saw that there's no big change. So now we do both. There is only one strict indication for the frozen embryo transfer, is the hyperstimulation risk. Hyperstimulation risk is for patients that we are collecting more than 20x, or with some hormonal levels, she's signaling to us that he were hyperstimulated. Hyperstimulation is something like swelling of the ovaries, some fluid accumulation in the lung and the abdomen. It's disaster. So to avoid the patient from this kind of important side effect of this IVF, in this case, those patients with the hyperstimulation risk, we freeze all embryo, and we are calling those patients 1 or 2 months after for the frozen embryo transfer.